Mental health has been a strong component in the national conversation about gun violence for decades. In recent years, Robert F. Kennedy Jr., recently chosen to lead the U.S. Department of Health and Human Services, has embraced unsupported claims that antidepressant use leads to mass shootings. But according to experts, connecting mental health in any way with the perpetrators of gun violence, be it a mass shooting or suicide, which happens far more often, could be problematic. Here's Dr. Daniel Semenza, Director of Interpersonal Violence Research at the New Jersey Gun Violence Research Center, with more.
That our ability to predict whether or not somebody dies by suicide, whether it's with a gun or otherwise, is barely better than chance. And that's barely gotten better in decades of research and practice. And so it's just not a good predictor of whether somebody is going to die by their own hand. And it's an even more difficult predictor of whether somebody is going to pick up a gun. A person with a mental illness, by orders of magnitude, are far more likely to be the victims of a violent crime than the perpetrator of a violent crime. And so when you're trying to talk about psychiatric interventions or mental health resource allocations and programs to find the person that is dealing with mental illness and predict if they're going to hurt themselves or somebody else, you really are talking in a lot of ways about a needle in the haystack issue.
In the media, especially with mass shootings, there's always a conversation. Did the perpetrator have some kind of mental health issue? Were there warnings? Were there signs? And sometimes there are. Do you think there might be a connection, or do we just not know?
Again, you can't use mental illness as a predictor of violence because it just doesn't predict violence very well. There's lots of people who are mentally ill, even severely mentally ill, that don't harm anybody. What you can do, though, is when there are people who are exhibiting signs or are coming into contact with systems, there needs to be a lot more vigilance around making sure that this person who might be throwing up red flags is given the resources they need or addressed them in a way that they are no longer doing harm.
My conversation with Dr. Daniel Semenza will be featured on 2 upcoming episodes of the Hi-Fi Health News podcast, available on YouTube at Hi-Fi Health News or anywhere you get your podcast.